Hello, this is Allison. This video is regarding new documentation requirements for procedural sedations in the emergency department. This video will go over where to find this documentation and the details of this documentation. So let's get started. You have a patient in room 9 that will be having a procedure with sedation. There's no change in the consent process for this, so let's look at the pre-sedation documentation. You'll go to the ad hoc section in the charting. You'll see a new folder titled ED Bedside Procedures. That is where all this documentation is. So the pre-sedation evaluation still needs to be done. This hasn't changed from how we did it previously, so continue to do it as you always have. Next is the ED pre-procedure timeout, and this is to be done immediately prior to the procedure. This is also to be done at the bedside. First, you have your fire risk assessment. This includes a fuel source, an open oxygen source and surgery above xiphoid, and an ignition source. This needs to be assessed and scored. If you have a score of 2, this is a low risk with potential to convert to high risk, so you may want to have the fire risk box at the bedside. The other part of this is the pre-procedure timeout. The pre-procedure timeout needs to be done on all cases requiring sedation in the emergency department. All bedside team members need to introduce themselves by name and role. The physician that did the pre-sedation assessment needs to report the pre-sedation assessment, the Mellon-Potty classification, and ASA scoring. The patient identity needs to be confirmed. The patient's allergies need to be reviewed. The procedure needs to be marked and visible if applicable. The consent needs read aloud. If there's any relevant imaging, it needs to be displayed. Address any anticipated critical events during this procedure. Address any equipment concerns. Verbalize that your fire risk is complete and what your score is. The procedure list needs to state the special or non-routine steps for this case and case duration and anticipated blood loss. Once that is complete, you can move on to your procedure. Once the procedure is completed, you'll need to return to the ad hoc charting and the ED bedside procedures and do your ED post-procedure debrief. This is to be done on all cases that require sedation. So what happens in this debrief is you report the consented bedside procedure is complete. You confirm the name of the bedside procedure with the team that cared for the patient. You review the administered medications. If there are any specimens that were obtained, they need to be labeled. And intra-procedure lab orders should be completed also. Address any equipment concerns during the procedure. Post-procedure care needs to be identified and any orders need to be placed. Also, this is the section where you address any sedation-related complications that may have occurred during the procedure. If there were any complications, you need to document what type of complication it was and the intervention performed. Once that is done, your sedation documentation is complete. Your intra-procedure documentation has not changed and should be documented in the iView sedation section as usual. That is all in this documentation. If you have any questions about this, please contact myself or Casey Mifflin, and thank you for watching.